Question 1. A client with gestational hypertension is being discharged. Which instruction is most important? A. Increase salt intake to prevent cramps. B. Report any blurred vision or headaches. C. Avoid walking or physical activity. D. Take an iron supplement every 4 hours. Answer. B. Report any blurred vision or headaches. Question 2. A laboring client is receiving 4-oxytocin. Which finding requires immediate action? A. Contractions every 3 minutes. B. Fetal heart rate of 180 bpm. C. Client is breathing rapidly. D. Client complains of leg cramps. Answer. B. Fetal heart rate of 180 bpm. Question 3. A postpartum client with Rh-negative blood delivered an Rh-positive baby. What is the priority? A. Administer iron supplements. B. Administer Rh immune globulin within 72 hours. C. Give Tdap vaccine immediately. D. Avoid breastfeeding for 24 hours. Answer. B. Administer Rh immune globulin within 72 hours. Question 4. Which task is appropriate for the nurse to delegate to a UAP in postpartum care? A. Assess uterine firmness. B. Provide perineal care. C. Educate on breastfeeding techniques. D. Interpret lochia color and flow. Answer. B. Provide perineal care. Question 5. A nurse is reviewing prenatal labs. Which findings should be reported to the provider immediately? A. Hemoglobin 11.5 G/DL. B. Rubella non-immune. C. Platelet 60,000/mm superscript 3. D. White blood cell count 11,000/mm superscript 3. Answer. C. Platelet 60,000/mm superscript 3. Question 6. A pregnant client reports severe epigastric pain and blurred vision. What is the priority action? A. Encourage hydration. B. Administer antacid. C. Check blood pressure. D. Perform a fundal height measurement. Answer. C. Check blood pressure. Question 7. Which newborn care task can be safely delegated to a UAP? A. Administer vitamin K injection. B. Monitor initial feeding. C. Bathe a stable newborn. D. Assess for jaundice. Answer. C. Bathe a stable newborn. Question 8. A nurse notes greenish amniotic fluid after membrane rupture. What is the nurse's priority? A. Prepare for vaginal delivery. B. Initiate an 4 fluid bolus. C. Notify provider and monitor fetal status. D. Increase maternal activity. Answer. C. Notify provider and monitor fetal status. Question 9. A postpartum client has a firm fundus but reports constant trickling of blood. What should the nurse suspect? A. Uterine atony. B. Retained placenta. C. Bladder distension. D. Cervical laceration. Answer. D. Cervical laceration. Question 10. A pregnant client in her 3rd trimester reports shortness of breath while lying flat. What's the best advice? A. Lie on your back with a pillow. B. Sit upright or sleep with extra pillows. C. Use oxygen via nasal cannula. D. Decrease water intake. Answer. B. Sit upright or sleep with extra pillows. Question 11. Which action demonstrates effective nursing delegation in maternal care? A. Assigning the LPN to assess a laboring client. B. Delegating fetal monitoring to a UAP. C. Asking the UAP to ambulate a stable postpartum client. D. Instructing the UAP to check fundal height. Answer. C. Asking the UAP to ambulate a stable postpartum client. Question 12. A nurse is caring for a client with preeclampsia on magnesium sulfate. Which finding is most concerning? A. Respiratory rate of 10 breaths/min. B. Mild muscle weakness. C. Urine output of 35 milliliters per hour. D. 2+ deep tendon reflexes. Answer. A. Respiratory rate of 10 breaths/min. Question 13. Which postpartum finding requires the nurse's immediate attention? A. Foul-smelling lochia. B. Fundus firm and midline. C. Perineal discomfort with urination. D. Light pink lochia on day 3. Answer. A foul-smelling lochia. Question 14. A nurse is assessing a pregnant client with suspected abruptio placentae. What symptom is expected? A. Painless bright red vaginal bleeding. B. Rigid, tender abdomen with dark bleeding. C. Gradual onset of uterine relaxation. D. High fever and foul-smelling discharge. Answer. B. Rigid, tender abdomen with dark bleeding. Question 15. A laboring client is experiencing late decelerations. What is the priority action? A. Turn the client to her left side. B. Document and continue to monitor. C. Encourage bearing down. D. Administer oxytocin. Answer. A. Turn the client to her left side. Question 16. A postpartum client wants to bottle feed. What is the nurse's priority teaching? A. Avoid holding the baby too much. B. Keep bottle sterile and discard after 1 hour. C. Use cow's milk after 1 week. D. Avoid burping the baby frequently. Answer. B. Keep bottle sterile and discard after 1 hour. Question 17. Which task should the RN perform instead of delegating to the LPN or UAP? A. Emptying a catheter drainage bag. B. Teaching newborn bathing technique. C. Assisting with ambulation. D. Taking routine postpartum vital signs. Answer. B. Teaching newborn bathing technique. Question 18. A nurse is evaluating lab results in a 32-week pregnant client. Which result is a priority concern? A. Hematocrit 32%. B. Hemoglobin A1C 9.2%. C. Blood glucose 112 milligrams per deciliter. D. Platelets 140,000/mm superscript 3. Answer. B. Hemoglobin A1C 9.2%. Question 19. A nurse is providing care to a pregnant client with anemia. What is the best dietary advice? A. Eat more dairy products. B. Drink coffee with meals. C. Include leafy greens and lean red meat. D. Avoid citrus fruits. Answer. C. Include leafy greens and lean red meat. Question 20. A nurse observes a client laboring rapidly with crowning visible. What is the priority action? A. Call the provider immediately. B. Leave the room to get the delivery tray. C. Stay with the client and support the perineum. D. Ask the client to bear down hard. Answer. C. Stay with the client and support the perineum. Question 21. A patient with blunt abdominal trauma presents with shoulder pain and signs of hypovolemic shock. What is the likely cause? A. Liver laceration. B. Splenic rupture. C. Pancreatic contusion. D. Intestinal obstruction. Answer. B. Splenic rupture. Question 22. In mass casualty triage, which trauma patient should receive care first? A. A patient with open fracture and stable vital signs. B. A patient with minor abrasions and alert status. C. A patient with absent radial pulse and altered mental status. D. A patient with burns covering 20% of body surface area. Answer. C. A patient with absent radial pulse and altered mental status. Question 23. What is the most effective initial intervention for a trauma patient with external hemorrhage from an amputated limb? A. Elevate the limb. B. Apply a tourniquet above the injury. C. Administer 4 fluids. D. Cover the stump with moist sterile gauze. Answer: B. Apply a tourniquet above the injury. Question 24. Which observation is most concerning in a patient with a chest tube post-trauma? A. Continuous gentle bubbling in the suction chamber. B. Occasional bubbling in the water seal chamber. C. Output of 30 milliliters per hour of serosanguinous fluid. D. Sudden cessation of drainage. Answer: D. Sudden cessation of drainage. Question 25. A trauma patient with a basilar skull fracture has cleared drainage from the nose. What is the nurse's priority action? A. Apply nasal packing. B. Perform a glucose test on the drainage. C. Suction the nose gently. D. Elevate the head of bed to 90 degrees. Answer: B. Perform a glucose test on the drainage. Question 26. In managing a trauma patient with a suspected cervical spine injury, which intervention is priority? A. Apply a cervical collar before moving the patient. B. Perform a chin lift maneuver. C. Place patient in high Fowler's position. D. Assess pupil response before positioning. Answer: A. Apply a cervical collar before moving the patient. Question 27. Which action is appropriate for the RN to assign to an LPN in the trauma unit? A. Develop a care plan for a new trauma admission. B. Perform an initial trauma assessment. C. Reinforce education on wound care. D. Perform a primary survey. Answer: C. Reinforce education on wound care. Question 28. A trauma patient is hypotensive and has muffled heart sounds and distended neck veins. What is the likely cause? A. Pulmonary embolism. B. Cardiac tamponade. C. Aortic dissection. D. Tension pneumothorax. Answer: B. Cardiac tamponade. Question 29. Which is the correct sequence in the primary trauma assessment, ABC? A. Airway, breathing, circulation, disability, exposure. B. Assessment, breathing, circulation, environment, disability. C. Airway, circulation, breathing, disability, exposure. D. Airway, disability, breathing, circulation, exposure. Answer: A. Airway, breathing, circulation, disability, exposure. Question 30. What should the nurse monitor closely in a trauma patient receiving large volume fluid resuscitation? A. Urine output. B. Respiratory rate. C. Skin temperature. D. Pupil size. Answer: A. Urine output. Question 31. A trauma patient with long bone fractures is suddenly confused to kypneic and has petechiae on the chest. What condition is suspected? A. Septic shock. B. Pulmonary embolism. C. Fat embolism syndrome. D. Tension pneumothorax. Answer: C. Fat embolism syndrome. Question 32. A trauma patient is showing signs of increased intracranial pressure. Which order should the nurse question? A. Elevate the head of bed to 30 degrees. B. Administer mannitol for push. C. Encourage coughing and deep breathing. D. Maintain neck in neutral alignment. Answer: C. Encourage coughing and deep breathing. Question 33. Which task is most appropriate for a UAP caring for a stable trauma patient? A. Measure and record intake and output. B. Evaluate pain relief after medication. C. Perform sterile dressing changes. D. Initiate patient teaching on mobility. Answer: A. Measure and record intake and output. Question 34. A trauma patient presents with paradoxical movement of the chest wall. What is the priority nursing intervention? A. Prepare for emergency chest tube insertion. B. Apply oxygen and monitor respiratory status. C. Encourage incentive spirometry hourly. D. Restrict fluid intake. Answer: B. Apply oxygen and monitor respiratory status. Question 35. What is the best position for a patient with a suspected head injury and increased ICP? A. Supine with legs elevated. B. High Fowler's position. C. Semi-Fowler's with neck in neutral alignment. D. Prone position. Answer: C. Semi-Fowler's with neck in neutral alignment. Question 36. Which trauma patient would the nurse assess first? A. A patient with a broken arm and capillary refill, less than 2 seconds. B. A patient with burns to the hands and stable vitals. C. A patient with shortness of breath and decreased breath sounds. D. A patient with facial abrasions and GCS of 15. Answer: C. A patient with shortness of breath and decreased breath sounds. Question 37. A trauma patient with rib fractures is at risk for which complication? A. Hematemesis. B. Pneumothorax. C. Acute renal failure. D. Stroke. Answer: B. Pneumothorax. Question 38. A patient involved in a high-speed collision has bilateral femur fractures. What is the most serious potential complication? A. Localized infection. B. Compartment syndrome. C. Muscle atrophy. D. Joint stiffness. Answer: B. Compartment syndrome. Question 39. A trauma patient is found unresponsive with snoring respirations. What is the nurse's first priority? A. Apply oxygen via non-rebreather mask. B. Insert a nasopharyngeal airway. C. Suction the airway. D. Reposition the head to open the airway. Answer: D. Reposition the head to open the airway. Question 40. In a trauma code, the nurse notices the patient has no pulse but shows electrical activity on the monitor. What should the nurse do first? A. Begin chest compressions. B. Defibrillate the patient. C. Administer epinephrine. D. Check for a DNR order. Answer: A. Begin chest compressions. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.